I'm Martin Wall. I'm the Customer Experience Manager for Atlas within Person-Centered Software. Medication accuracy means that people who are due medication receive it at the right dose, at the right time, and via the right route without ever running out. It is absolutely essential for the well-being of residents within a care home environment that medication is managed in an accurate and timely manner. If somebody's going without important medication, it can have really disastrous effects both on their health, and also it could affect the way they interact with other people that they live with. The first one's going to sound strange, but it's people run out of medication. So the first error is you can't give it because you haven't got any. The second one would be that medication has been given to residents the wrong time. If they've got two sorts of the same item, one's taken at night, one's taken throughout the day. If you get those mixed up, that can be disastrous. And the third one is that nobody records what they've done with the medication. So if you are auditing what's happened, you don't know whether your staff gave those items or not. This eMAR provides real support for not just the person who's giving the medication, but for anyone who is in charge of care homes. Using the Atlas Central website, it's possible to see in real time medication that was due, let's say at 8 o'clock this morning, that's still outstanding. Every time medication is given, it will drop off that list. So you're 100% confident that when it tells you there are no more meds left to give, they've all been accounted for. I'm going to jump to the last of them. The way that the Atlas system works is it's so visual. It's designed on a traffic light system with red being warning. And if an item, something it's paracetamol or whatever drug, appears on the system in red, then that item needs to be accounted for. It doesn't necessarily need to be given. You know, Mary may not be in pain, but you need to record whether or not that item was given. And the final one, the one in the middle, regarding making sure that the right medication is given to the right person at the right time, is really, really easy to do, because all of the medication that's supplied by your partner pharmacy will contain a barcode on the pharmacy dispensing label. You would scan the medication and it will confirm that you've chosen a drug that is required for the resident at this time, and it's safe to proceed. If you've picked up something that isn't due today or has already been given by somebody else and you hadn't noticed, it will alert you and stop you from giving that item. The procedures and protocols that a care home can put in place to ensure medication accuracy using the Atlas eMAR system revolve around making sure that their staff are trained, which is the first thing, and the Atlas eMAR system contains 3 e-learning courses to make sure that that has happened. The next one is you can profile residents' medication so that you can be confident that the member of staff who is administering it has been signed off by you as having the appropriate skill level to do so. The final part is you can actually then set each drug so that it is time sensitive. You can place alerts to say, go to Mary first, because she gets anxious if she hasn't had her medication early in the day, rather than going a particular route. If a resident's name appears on the system in red, you're able to go and administer their drugs. Medication accuracy is important within a care home environment because the registered manager is responsible should a member of staff under their supervision make mistakes with medication. In its worst case scenario, if the resident was put into hospital or worse, they are held responsible. So they need to be confident that the medication that is given within the care home setting is appropriate and given at the right time. The Atlas eMAR system really does help you to promote the level of care that you want, i.e. excellent. It will prompt you to do things that are not necessarily legal requirements. It will ask you to obtain witnesses for certain levels of controlled drugs, which are deemed as best practice to do. We don't want you to just get the legal requirement. We want you to exceed it.